Okay, so again, we've got our vestibular cochlear apparatus, right, which sits, the cochlear component sits in the bulla, right, the bubble of bone right here, and then these, otolith organs, the saccule and the utricle, and then these semicircular canals kind of go out back this way. The semicircular canals, there are three of them. There's an anterior one, there is a posterior one, and then there is a lateral one, or this is known sometimes as the horizontal semicircular canal, and each of them has a swelling, like a little vestibule, and that's why they call the vestibular system, for example, it's like vestibule is like an entryway, right? And this is like the entryway into the semicircular canal. Well, inside here is a membrane. It's kind of like an epithelium, much like the basilar membrane, which runs down the center of the cochlea, right? That runs down the cochlea and upon which the hair cells sit in your inner ear. Well, in these little swellings, these ampulla, there is a membrane called the crista, which is analogous to the basilar membrane. And upon the crista sit hair cells. There are hair cells also, cells with stereocilia, in the vestibular apparatus. They're going to move in response to the movement of fluid, depending on which direction you happen to be going, right, in sort of an angular, direction. And above the crista, above the hair cells, is a gooey membrane. So just like above the basilar membrane, where the inner and the outer hair cells sit in the cochlea, and there's, remember, that gooey tectorial membrane, that have, some of the hair cells have their hairs stuck into that membrane. Well, in the ampulla, in the the semicircular canals, the crista is the analogous to the basilar membrane. The hair cells sit on it, and their hairs stick up into a gooey overlying membrane too, known as the cupula. So there's a cupula, gooey membrane. So if you turn like a certain direction, well, you're going to move fluid, in the semicircular canal. It depends on which direction you're moving, right? You'll move fluid differentially, and it'll push on that cupula. It'll bend those hairs, and it'll initiate, a response that can give you information, again, about angular acceleration. There are about 7,000 of these hair cells in each one of these ampulla, each one of these little openings or entryways into each semicircular canal. Again, just there's a lot of goo in the vestibular cochlear apparatus. You didn't realize that, that balance, detection of acceleration and hearing, had so much